Welcome, and thank you for taking the time to watch this demonstration on meaningful use, how to achieve the core and menu measures. This video demonstration will cover menu measure number 7, medication reconciliation. Let's get started. First, let's open up the PDF from the MTBC website and learn more about the requirements. This is the eligible professional meaningful use menu set measure number 7, medication reconciliation. The eligible professional who receives a patient from another setting of care or provider of care or believes an encounter is relevant should perform medication reconciliation. The measure for this requirement is 50% of the patients who are in a transition of care should have medication reconciliation performed for their visit. And there's an exclusion for any provider who's not the recipient of any transitions of care during the EHR reporting period. So if you have 50% of your patients who are transitioned to you from another provider, you should perform medication reconciliation for those patients. And let's scroll down and take a look at some of our definitions. Now, a medication reconciliation is the process of identifying the most accurate list of medications that a patient is taking, including the name, dose, frequency, and route, and compare that information to the medical record from an external list that's been obtained from a patient, hospital, or another provider. Now, they mention a relevant encounter, an encounter during which the eligible professional performs a medication reconciliation due to new medication, or long gaps in time between the patient encounters, or for other reasons determined appropriate by the eligible professional. Essentially, an encounter is relevant if you believe it is relevant. So if you believe that the patient has been out of the office for too long, or has been seeing other providers and other specialists, then perhaps that might be a time to perform medication reconciliation. A transition of care is the movement of a patient from one setting to another. If they're going from a hospital to private practice, or among other private practices or specialties, or here they give the examples of long-term care, home health, or rehabilitation facility. So if the patient is moving between these different facilities, then a medication reconciliation should be performed. The attestation requirements here are numerator, denominator, and exclusions. Denominator being the number of transitions of care that you've received during your 90-day reporting period, and the numerator being the number of transitions of care in the denominator where medication reconciliation was performed. So if you have 100 patients that have been referred to you over the course of 90 days, you should provide medication reconciliation for 50 of those patients. And the exclusion again would be any provider that does not receive those transitions of care. Some additional information: only patients whose records are maintained in the EHR should be included. In the case of reconciliation following transitions of care, the receiving eligible professional should conduct the medication reconciliation. Meaning, if you're referring a patient outside of your practice, then this may not necessarily be the menu measure that you should choose. More or less, if you are the recipient of referrals and recipient of patients who've left nursing homes or who've left rehab facilities or so on, or have a long duration between visits to your office, then you should perform this medication reconciliation. And finally, the measure of this objective does not dictate what information must be included in medication reconciliation. Information included in the process of medication reconciliation is appropriately determined by the provider and the patient. So an external list could be anything from the patient bringing a list with them, or your ability to access an external source of medication information. And let's take a look at how that's delivered through the MTBC EMR. When we're on the patient's plan of care, one of the options that we have on the patient's plan of care is an option called drug history. Clicking on drug history will open up external medication information that has been received from our integration with SureScripts, and SureScripts being the clearinghouse for all electronic prescriptions in the country. Any prescription that's submitted electronically by any provider must go through the SureScripts clearinghouse. SureScripts also provides a feedback loop to the practice in the form of drug history and also in the form of drug formularies and patient benefit plans. So this is one of the services that MTBC is certified to deliver through our EHR. Clicking on drug history will open up the drug history for this patient. That is a current drug history as well as an external drug history. At the top of this form, we have patient medication history that is inside the EMR. We can see the current list of medications that will resemble the current list of medications that are on the patient's plan of care. We can see the past medications that are no longer on the patient's active medication list. But down below we have an option called External Medication History. Here we can see all of the prescriptions that have been submitted for this patient by providers outside of our office. And we can scroll this list to see all of those medications. If the patient has any medications that have been submitted by another provider, you'll be able to recover that information and view it directly in the EHR. Now, this information may not always be complete. This information may not always include SIGs and quantities and refills, but to the extent that SureScripts has that information electronically, they will present this information to you through the drug history tool. And remember, you must provide this drug history information, or you must check this drug history information for 50% of the patients who've been received from a transition of care. Additionally, if the patient brings a medication list with them and you enter that medication as part of the patient's past medical list, then you've also met this requirement. So you can meet the requirement through the external drug history or through the patient providing their medication list to you and having a member of your staff enter it into the EHR and save that information as part of the previous medication list for that patient.